Research shows that millions of people worldwide fall victim to various diseases every day. To identify the causes and origins of these ailments, doctors conduct various tests, enabling them to determine the source of the disease and administer appropriate treatment. One advanced method among these medical tests is the MRI scan. You may have heard the name before, yet many people know nothing about MRIs. Some even fear that a patient could die during the procedure. Is undergoing an MRI actually risky for patients? You will find out in today's video. Welcome to another new episode of the Deep Mystery Channel. The advent of MRI technology brought significant changes to the medical world, greatly simplifying the work of doctors. Nowadays, physicians frequently use MRI scans to diagnose a wide range of conditions within the human body. MRI scans are capable of accurately detecting hidden diseases, providing precise results. It is considered a reliable and preferred method for diagnosing subtle ailments in various parts of the body. However, you might still be curious. What exactly is an MRI scan? How does it work? And is it truly dangerous? The full form of MRI is magnetic resonance imaging. It uses magnets to capture clear images of internal organs, a process lasting anywhere from 15 to 90 minutes to identify specific diseases or assess normal conditions. You might be surprised to learn that while X-rays and CT scans rely on harmful radiation, MR is utilized magnetic energy instead. This makes the procedure fundamentally different from CT scans and X-rays. According to experts, hydrogen atoms present throughout the body spin, creating signals that are transformed into images, which doctors then use to make diagnoses. The human body is composed of 70% water, and every water molecule contains approximately 2,000 hydrogen protons. The MRI machine generates a strong magnetic field that interacts with these hydrogen protons. The combination of these elements generates images of the body's internal organs, allowing doctors to easily identify signs of disease by viewing them on a computer. MRI technology produces clear images to diagnose conditions affecting various parts of the body, such as the brain, spinal cord injuries, liver, bones, and muscles. There are certain precautions to observe before undergoing an MRI. Failing to do so could lead to complications. Many people mistakenly believe they must fast before an MRI, but this is incorrect. You may eat unless a doctor specifically instructs you otherwise. While fasting is often required for other types of scans, there is no such mandate for an MRI. In fact, some doctors advise patients to drink plenty of water beforehand, as higher hydration levels allow the MRI scanner to capture clearer images of deep-seated body structures. Before the scan, medical staff collect any metal objects the patient is carrying. Patients are not permitted to enter the MRI room while wearing metal items, such as jewelry, watches, dentures, or hairpieces containing metal, and must remove them. Even gold dental implants must be disclosed to the doctor. Tattoos can also cause issues during an MRI, so it is important to inform the medical team about them in advance. You might wonder why all metal objects must be removed from the patient's body before the procedure. Why don't doctors simply perform the scan with the metal objects in place? There is a specific reason for this. MRI scans rely on magnetic fields. Metal objects are removed to prevent them from being attracted to the powerful magnets within the MRI system. Otherwise, complications could arise during the scan, potentially resulting in serious injury to the patient. Consequently, metal objects are strictly prohibited near the MRI machine. Patients are usually provided with a specific hospital gown for the procedure. If a patient prefers not to wear the hospital-issued gown, they must still ensure that all metal items are removed before the scan can proceed. Although most people consider wearing the hospital-provided gown to be a safety measure, no anesthesia or pain-relieving medication is injected for an MRI, as the scanning process itself is painless. However, Since the patient is scanned while inside an enclosed space, many people do feel afraid. It is advisable to discuss this matter with the doctors beforehand. Doctors often administer a mild sedative or soft medicine for this purpose, which helps reduce the patient's anxiety. Anesthesia is typically administered during an MRI scan when the patient is a child, as patients must remain perfectly still during the procedure, something young children often struggle to do. There is also a crucial point to consider. If a patient has kidney issues, it is mandatory to discuss this with the doctors. They will assess how well the kidneys are functioning. If the kidneys are not working properly, the MRI cannot be performed. You are now aware of the necessary preparations for an MRI scan. Another question remains: how is the scan actually performed? The MRI machine consists of a small cylinder that is open at both ends. During the scan, the patient lies on a bed positioned in front of the cylinder and is then moved inside it. The machine uses magnets to capture clear images of the body's internal organs and transmits them to a computer. The specific part of the body to be scanned first depends on the patient's condition. The MRI process then begins, typically taking anywhere from 15 to 90 minutes. A computer is used to operate the machine and capture highly detailed images of internal areas, enabling doctors to make a diagnosis. It is mandatory for the patient to remain completely still to ensure the images are clear. Otherwise, the images will be blurred. This is how the MRI scan is completed. A question that often arises is whether an MRI scan can be fatal. The answer is yes. This scanning machine can, in some instances, lead to death. Although all metal objects are collected from the patient before the scan, errors can occur, and a piece of metal might inadvertently remain on or in the body. If metal objects, such as screws, sharp items, or nails, are present during the MRI, it poses a life-threatening risk, as the machine's powerful magnets can violently attract these objects. Also, the machine makes a very loud noise during the MRI scan. Patients often get frightened upon hearing this sound, fearing that they might be about to die. In reality, however, it is nothing to worry about. To prevent the patient from hearing this noise, many doctors place plastic headphones over their ears. So friends, that covers the entire MRI process. That's all for today's video. I'll take my leave for now. See you in the next episode.